directed health measure, and the one for restaurants is this directed health measure with regard to elective surgeries is statewide. And we talked about how hospitals will be able to start doing elective surgeries with the restrictions of 30% of their hospital beds open, 30% of their ICU beds open, and 30% of their ventilators open, and 2 weeks worth of personal protective equipment. So that's for the hospitals doing elective surgeries. But this directive health measure also includes dental offices and veterinarian services. And so we have two guests with us today to talk about that. Dr. Kraft, who's with the
coronavirus has certainly affected all of our lives here in Nebraska, and dental health care has been no exception over the past few months. As we focused our efforts primarily on providing emergency care services to patients to lessen the burden on the hospital emergency rooms. But now, as we prepare to reopen elective dental services on May 4th, the DHHS Office of Oral Health, the Nebraska Board of Dentistry, and the Nebraska Dental Association have been in constant communication, and we have pulled our resources together to review the latest evidence-based information from the American Dental Association, from the Centers for Disease Control, and the Centers for Medicaid and Medicare. We want to ensure that our message to the dental community is clear and consistent at this critical time. And we want to assure the general public that dental services will proceed with safety precautions for patients, dental staff, and providers being at the top of the priority list. Accordingly, the Nebraska Dental Association has been working hard to produce interim guidelines and recommendations for dental offices. Their final report has been reviewed by DHHS and the Board of Dentistry and will be a living document with frequent revisions as more becomes known about COVID-19. Certainly, there will be increases in universal precautions with enhanced patient screening, elevated personal protective equipment, higher levels of infection control, and limits on certain procedures. This will mean a new normal for the dental world. Private offices, dental schools, FQHCs, other dental programs, their openings may vary. The decision to reopen or remain closed is up to each dental practice. But these new guidelines produced by the NDA will assist people in making that decision. I'm confident that the dental profession can rise to this challenge, similarly as we did in the 1980s with the AIDS crisis. So with that, I'm going to introduce Dr. Ken Tusha, the immediate past president of the Nebraska Dental Association. He's a general practitioner in Knox County. He understands the rural situation and how these new guidelines can help the dental profession moving forward.
Thank you, Fritz, and thank you, Governor, for all the information and keeping us informed on a daily basis. It's very much appreciated. We have a document similar to what the Restaurant Association has. It's the Recommended Office Opening Protocols. It can be accessed on our website, which is nedental.org, and that's open to any member of the public can access this information. And be aware that, as Fritz said, this is going to be a living, breathing document. In fact, I've got that one I just held up is today's revision. This was the one from 6 days ago. So they change. And as the CDC and other entities come out with added information, we know that this is going to change as time goes on. And some of the things that we want to stress to patients is dentistry is probably not going to get turned on just like a light switch. It's going to be more like a dimmer switch. And we're going to slowly open up our offices after we have trained our assistants and our hygienists and our whole team to the new protocols. Our guidelines include the training that I mentioned. and screening the team on a daily basis, as well as patients as they come in. Patients will have their temperature taken when they come in, as well as go through a number of questions. And they may be sitting in their car when they're doing this. We may be talking to them on their cell phone. So it's going to be a different world and a new normal. We're going to eliminate patient-to-patient contact when they get in the office. We won't have the crowded waiting room that maybe some of you may recall. We're going to practice social distancing patient-to-patient wise, and we won't be able to see as many patients. We're going to have enhanced disinfection procedures, and we're going to decrease the aerosol procedures and assure that everyone has the proper PPE, personal protective equipment, to protect themselves and the public. You can be assured that we're going to do everything possible, and dentistry went through an episode like this back in the 80s with the AIDS crisis, and that's when all of a sudden dentists started wearing gloves, wearing masks, and rest assured that we got this. We will beat this. Thank you.
Thank you, Dr. Tusha. I know she said you're going to be reducing the aerosol procedures. Does that mean that drill thing that always is kind of really uncomfortable in your mouth? Is that we're going to see less of that?
The noise of it, yeah.
The noise of it?
Yeah.
Oh, okay, well.
Yeah. No, we're going to, that's going to be done on a basis where maybe we see those patients early in the day and then.
Oh, I see. So you're going to see those patients early in the day and then, okay, very good.
And later on.
So I'm not getting out of that. You're saying I'm not getting out of that, though?
No, you're not.
I'm not getting out of that. Okay. Never mind. All right. What else do we need to talk about here today? Actually, I thought I had my sheet, but